Your heart needs to be strong to keep up. Flora, for a strong heart today.
According to statistics, every day in South Africa, 240 people have a stroke. That means 10 people have a stroke each hour. Now, if I were to ask what a stroke is, not many of us would be able to answer. So today I'm paying a visit to the hospital to learn more about this.
Stroke is the third biggest cause of death in our country and a leading cause of adult disability. The effects of stroke can be devastating and include brain damage, which manifests as weakness or paralysis, sensory disturbances, pain, speech problems, and memory and emotional disturbances.
Darren, so what exactly is a stroke?
It's basically an attack on the brain when there's too little oxygen delivery to those brain cells, which we call neurons, and normally comes about as a result of blockage of the pipe. So the blood vessels on the surface of the brain become blocked, and that causes a lack of oxygen and nutrients. The other mechanism is via a blood vessel that actually bursts, and that bleeding on the brain then leads to focal signs, and those are basically clinical pictures and signs that we can pick up if we know how to screen early and quickly for someone having a stroke.
How is a stroke diagnosed and treated in an emergency room?
The diagnosis basically is normally one that involves the acronym FAST, F-A-S-T, and the F stands for facial droop. So you normally have a hanging side of the face with the mouth corner that's dropped. So if they drink water, for example, it normally runs out the corner of the mouth. The A stands for arm, and allow me to demonstrate with your arms. If you stretch out your arms with your palms towards the ceiling and you close your eyes, I then ask you to keep your arms there and look if there's any droop of the arm or if it drifts, and that will tell me if your arms are weak. Right, you can relax now.
Okay, am I okay?
You're fine. The S stands for speech, so we actually ask you to say a simple sentence like, today the sun is shining, tomorrow I want to go home. And we listen to your speech to see if the tongue is heavy or slurred or labored, and that's also a focal sign. And the T is for time, because the longer we take to exclude that you don't have a hemorrhage and to reverse the process of too little oxygen to the brain, the more brain is damaged. So time is of the essence. Then there are a few other clinical features that help us recognize stroke that are atypical, and that's someone can become just acutely confused, or they can lose the ability to understand you when you speak. And that's not common, but it does occur. But before we get any further, I think I need to get to the CT scanner to show you why it's so essential that we exclude a bleed in the brain. Because if the cause is a blockage and a thrombus, we can reverse the process, if it's in time, to dissolve that clot. So let's go and have a look at that scan.
A CT scan is usually one of the first tests done in a stroke evaluation, particularly during an acute stroke in the emergency room. This test can show areas of abnormalities in the brain and can help to determine if these areas are caused by insufficient blood flow or a ruptured blood vessel.
That was intense.
Very.
How is a stroke related to heart health?
Well, the blood vessels in the brain often represent, and they show what the rest of the body's blood vessels look like. So if you have what's called atherosclerosis, that just means fat lining the blood vessels, that can cause obstruction of the blood flow, and that then can hamper, as in heart attacks, the delivery of oxygen to the heart muscle, and similarly in the brain, the delivery of oxygen and nutrients to the brain tissue itself.
Can I prevent a stroke from happening?
You certainly can. All the lifestyle issues around the management of stroke are controlling your blood pressure, making sure that your sugar levels are controlled, looking at things like your fat metabolism and cholesterol issues, and then of course smoking. Stop smoking. So along with those lifestyle modification factors, the most important thing for the public out there is to recognize a stroke early, which includes the FAST method, and the T standing for time. The quicker you get someone to a hospital for a CT scan and to reverse the problem, is the quicker they can have a restored brain function. So remember, get to the hospital as soon as possible.
Of the 240 people affected in South Africa each day by a stroke, a quarter don't survive. You and your loved ones don't need to be a statistic. Reduce your risk of stroke today. Be ready to spot the signs in others and act fast.
Good health and looking after your cardiovascular wellness will ensure that you don't become a stroke statistic.
Your heart needs to be strong to keep up. Flora, for a strong heart today.